Um, so this is actually a continuation of the conversation we've been having, beginning with the micro lab. Those of you who were in the micro lab, we were looking at the future of global health. This is about rethinking global health. I think you will agree with me that the conversation is very timely. So we're gonna do this. I think everybody knows Christine, but maybe you should introduce yourself just
Okay.
a couple of minutes.
So I'm Christine So. I'm the Executive Director of the Global Health Council, and we'll be talking, I think, a little bit more about what GHC is and does. But I'll just say I come from a background of technical and implementation work. So I'm an epidemiologist and a demographer by training, worked in the field for many, many years, mostly in West Africa. And now have been back in the States for a couple of years trying to figure out where I fit into this big puzzle of global health coming out of the US and in particular Washington, DC.
And we couldn't have had a better interlocutor, view one too, because the Global Health Council really is known as the institution for a number of years that have been the place where the conversation about advancing global health has come. We know that when it was first created, it was actually the National Council for International Health, and then turned into global health. And so we'll have a chance to come back to that. But I want to actually take advantage of something that I heard during the break from Roy Jacobstein, and I think he made a very, very good point. I think one good place to start our conversation before jumping into what the future would look like might be to just revisit the unfinished business, because one of the things when you start thinking so fast about the future is you always run the risk of throwing the baby with the bathwater. And I think there's been some good things. So maybe, Christine, let me ask you a question about that. Let's talk about, from your point of view, the things that we need to continue to pay attention to. What is the unfinished agenda look like?
Well, I mean, writ large, it's the MDGs. And we do kind of get ahead of ourselves, and then we have to kind of step back and say, oh wait, we still got this work that we committed to that we have to get done. And we have less and less time, and I think the paradoxical thing about when you don't have very much time left, you also have a tendency to throw up your hands and say, okay, I don't have enough time left, so why should I bother? And in fact, I think that what we need to do is flip it around and say, you know, we have to make sure that we're pushing as hard as we can in the time we have left to get as much done as we can. For me, one of the really critical moments that came as a result and as part of the whole MDG push was several years ago when UNICEF did some really critical research around, we see where we are with the MDGs, we're getting there, and at the national level things are looking optimistic. But once you start unpacking that and looking at disaggregated information, looking at different communities, different regional levels, different populations, we see that in fact there are lots of people being left behind. And so that, I think, really changed the conversation. I think it got us going on the way we're going towards the Sustainable Development Goals or whatever they're going to be. It really brought equity back to the conversation. And I think that's the piece that we're still working on is with the MDGs, how can we be doing those pretty basic things that we know work, but getting them out that last mile, getting them to those communities that haven't been reached so far, making sure that we have an inclusive agenda with what we're still doing now, as well as making sure that inclusion is a big part of what we're going to be doing.
Wonderful. So, in other words, let's not forget that we still have, there's a lot of conversation about the last mile, about, people that we really need to reach. There are still a number of people on this planet that are suffering from extreme poverty. So we tend to talk about, let's focus on those people who are living on less than $1.25 a day. So let's come back to the Global Health Council, because one of the things that is happening as the conversation about global health really goes global, some people have actually been a little critical about saying, Global Health Council, is it really global? And what are you doing in the new reinventing the global health to make sure that it is truly global and it's not just seen as a US focus and again the US dominating the conversation, so forth.
Yeah.
Talk to us a little bit about that.
Well, I'll say, I think for me, the title Global Health Council has two senses. One is thinking about global health and what is global health, and then one is, are we a global organization? I'll just say, and I'm setting us up for a later question, I think, but I really am thinking about global health for the Global Health Council and where we're going with this as the health of the global population. So it's no longer an us and them, it's really the global population and how do we ensure health. For the Global Health Council, we traditionally have been a primarily US-based organization, although we're a membership organization. We've got lots of members, and I've actually been surprised in looking at the membership list how many small NGOs and people not based in the US we had on the rolls previously, and we're working to get back into active membership. We are resource constrained like everybody else, and so right now we are building our base in the US. But I think one of the really encouraging things that I see and that we're actively tapping into is that there are just so many more global and regional alliances and coalitions. So we don't necessarily have to be the coalition for the globe. We have to be connecting into those other networks and alliances and coalitions and working with them. So, I mean, something that we've heard repeated across the conversations of the last 2 days is this idea of partnership.
Yes.
And so, we're looking very much to link with those other groupings, and they take all sorts of forms, to work in partnership.
Including, I imagine, the way it's changing in the United States.
Absolutely.
Because you have, for example, in the triangle, we have the Global Health Consortium, which is a consortium of universities and implementing organizations and so forth. And we are seeing these hubs throughout the United States. So what is the space that is left for an organization like the Global Health Council? Frankly, because it used to be known for the big conference every year, and then now we have a number of these conferences happening. You've got Women Deliver, you've got the HIV/AIDS, you've got the Consortium of Global Health Universities. Talk to us about that. What would you see?
Well, I mean, in fact, I think that there's this huge kind of overriding space, which is we're talking about the whole of global health. And there are so many, I mean, as you just said, there's so many different convening spaces, there's so many different actors. We've been talking again over the last couple of days about how we tend to be siloed and there are all these different communities and constituencies. And Global Health Council is really seeing itself as a space where we bring all of those pieces together and we talk about why global health is important and what all of those pieces mean as a collective, and we talk about speaking from the collective voice. When we go up and we advocate on Capitol Hill and we start having these conversations, they say, members of Congress or their staff say, oh God, we talk to each one of these constituencies. It's so nice to be able to talk to somebody who can bring those voices forward but also helps tie them together. Mm-hmm. So that's very much what we're looking to do. In terms of the conference, I mean, I think that's just an example of one of the challenges that we have and that we're thinking about on a daily basis, which is how do we add value?
Yes.
We don't have a purpose if we're coming in to duplicate what's already happening.
Exactly.
So we are looking at those spaces that aren't necessarily filled, that are strategic and need support, and really trying to move into those spaces. And I think that we may very well end up having some sort of a convening, or we may end up partnering with different convenings, which is what we're doing right now. And in any case, whatever we do, we very much want to have it oriented so that there is action coming out of whatever it is that we're helping to support.
Yeah. With such a strong background in the field, you've been based in the field, you've spent so much time in Mali, in West Africa, you've worked with other international organizations like UNICEF, and so forth. I'm sure you have your views about changes that need to be made for an organization like Global Health Council to be more effective in the future. Can you talk to us a little bit about that?
Well, I mean, again, I think it is really a matter of having an open perspective, you know, and shifting the way we think. The U.S. government has been a huge leading force by right of funding levels, by right of activity and the way that they've organized. But the whole landscape has shifted. And there's so many other ways that people are getting involved, and Ken talked about this morning a bit, but you know, there are so many other ways that individuals can be involved. There is so much more insistence, and absolutely right insistence, from the Global South saying we have to be decision makers, we have to be accountable, and so how do we level that playing field?
Yes.
And how does Global Health Council help support, you know, and I joke, I mean, and I'm sure people in this room have heard me say this, I joke about, you know, my job consists of trying to herd cats and connect dots. And, you know, so really thinking about being a facilitator between some of those international organizations, between something that I'm very interested in is making sure that civil society has a place at the table. You and I were at a meeting on universal health coverage a week ago, and you know, we've talked about it. There was not a strong civil society presence there talking at the highest level about how civil society is involved and supporting and being affected by universal health coverage and what we're talking about and rolling that out. So, you know, I think those are places where we can perhaps provide momentum, provide support, flag areas where maybe the right attention isn't being given to get those balls rolling.
Let's talk a little bit about the next generation of global health leaders, because I always like to focus on that, because we're in a thriving academic environment, and we hear the question often from students and those who are responsible for training students. Reflecting back on whether it's skill sets or whether attributes, what do you think was so instrumental in making you a successful global health practitioners, and what can you advise students who are looking to embrace the global health field? What would you like them to focus on? What skills should they be developing?
I think that's a very hard question, because I think that things have shifted fundamentally from when I was getting my MPH. I mean, I went into the Michigan Population Fellows Program, which I'm sure some of you are familiar with, but after my MPH, and I was placed in a position, in a job in Mali, which was working regionally in West Africa. But at that point, I had a skill set that was not available. And so I was bringing in technical skills and also doing technical transfer of skills, and I had a role to play. Today, that same thing is not necessary, because the capacity has been built, not entirely, but I mean, there really is a much greater capacity and a much greater role. We should be building schools of public health in places like Mali and training people there to be doing that kind of work. To your question, I mean, I think, you know, it's amazing how young people are really genuinely engaged and committed to the idea of global health and global change. It's education or business or whatever it is, but I mean, really being global citizens. I think you said that earlier. And, you know, we need to be thinking about how can we help them be change agents. We were just speaking backstage with Sandhu, and, you know, he was saying we need to not just be thinking about linear paths, but thinking about how do we equip people to be entrepreneurs, and maybe they turn that into something new. And so thinking outside of the box is a bad answer, but I think it's a challenge for academic settings and for us, and part of the reason that I'm going roundabout and answering you is that I'm not satisfied with my answer yet. And it's something that I'm spending time on. You know, I've actually been going out and visiting some universities. I hope to be doing more of that. We've got this event coming up on May 9th, and we're going to have a lot of students and young people, young professionals at that event, and I'm very interested in hearing from them and thinking with them about, you know, what are the challenges that they're confronting, and how do we work to make to facilitate that professional trajectory for them.
Let me, because we're almost out of time, believe it or not. Let me end with a question that's going to be a follow-up on a conversation last year. We had Chris Elias, head of global development, sitting where you're sitting last year, and he brought up this issue of the blurring of the lines between the nonprofit sector and the private sector. And you know, we've heard a lot from Ken this morning. We've heard from Michael Bisdak questioning the shared value proposition. Can you give some final thoughts about how you see our community embracing these new players, especially those that are coming from the private sector?
Yeah. I mean, it's been interesting because, again, Global Health Council, we very much take a big tent approach, and we have private sector international development partners as members. We have corporations either as members or that we're partnering with on various initiatives. And then, of course, we have NGOs and nonprofits of various types. And so we've been thinking very much about what that relationship is. You know, for me, and again, coming from the field where the private sector is absolutely there in everything that we're doing, if you look at itineraries of care, people start with private sector providers, usually before they ever get to a government-supported clinic of some sort. Now, when you talk about private sector, there's the challenge of what is the private sector? Right. So exactly. Is it, you know, the traditional private healer who you have to pay, or absolutely. Is it the pharmacy, or yes. You know, you've got all of those. But we're all existing in the same space, and so we need to be acknowledging that we're in the same space. Yeah. I was really happy to hear Michael's presentation this morning because in 2 weeks in New York there is a Shared Value Summit that FSG is hosting, and I'm going to be there, and we're going to be working on discussing health and global health and shared value. And so I'm very happy to have the points that Michael raised this morning as reference for that conversation. But I guess just to end, I think that that partnership between public and private, you know, all of these things are how do, whether it's public and private, whether it's one person and their technology, when things come together and they collide and there's that spark and a catalyst, and then it gets something going. I mean, I think that's why we think public-private is interesting, but we've had all these examples here that are along those lines as well. And so I think it's where you get that switch point. And I didn't mean to get to that point as my last thing, but I really do. You know, you get to that and then it sparks and it goes off.
Yeah. Why don't we cheat a little bit and take another couple of minutes? I wonder if you could react to something we heard from Ken this morning was an encouragement and a call for people to work outside of the system. Mm-hmm. It made me stop a little bit and pause. Did you have any reaction to that, to that call?
I did. I mean, again, what I tend to be focusing on is coordination. And, you know, and we were talking about this a little bit in our micro lab as well. You know, should we have 20,000 points of light that are all working on their thing, or is that too many? Should we be channeling them? You know, for me, it's really, and the Open MRS presentation was a great example of this, where, you know, having those individual initiatives, I think is great because it's a democratization of, you know, people using their own initiative and their own brilliant ideas, and the ODON device, you know, I mean, all of those are great things. But then how do you, connect those dots so that we're not, for example, recreating Open MRS in 16 settings at the same time and not learning from each other? And I guess that's, again, where I see organizations like Global Health Council, coalitions, alliances coming together and sharing that information and facilitating, connecting and networking, so that if somebody is working on something, they have a chance and a space. And that may just be facilitated by technology, it doesn't have to be a person doing it, but that there is something that facilitates those connections so that they can, again, come together and put those synergies together to be then expanding what they're doing and not recreating what they're doing. And you know, I have seen over and over and been very frustrated by people who, you know, come in and use precious resources and their energy and frankly sometimes waste people's time because they're recreating something that has been done. But they don't necessarily have the way to connect into that. And so I think it's that connector that is really critical. And so yes, let's have lots of people working outside the system, but let's also have platforms that allow them to come together to make those connections.
Fantastic. Well, I know I could carry this conversation on for much, much longer.
And we will.
Unfortunately, we're running out of time. So let me just invite you to, let's say, big thanks to Christine for